Welcome, everyone, to the webinar for what to know during renewal season. So glad you are here and could join us today. So we're going to go ahead and get started. My name is Jacob Setzer. I am a relationship manager here at Guidestone. And as some of you may know, the renewal season and the re-enrollment season is one of my primary roles and functions as a relationship manager. I also have with me today Cade McBride from our new business team and insurance consultant. How are you, Cade?
I am good. I'm good. Excited to be here.
Absolutely. All right. Well, I just want to begin with a quick overview of kind of where we're headed today. We're going to start by talking about some common renewal questions that come up during this season. And then we're going to talk about how to make re-enrollment easier for yourself and your staff, and then how to control costs, and then some general renewal tips that Kate is going to walk us through as well. Now, I do want to start out by saying you'll hear me use the term renewal season or re-enrollment season kind of interchangeably. The way it works is actually the renewal season is typically for the employer to renew their group plan, and that's kind of when that term is used. Re-enrollment typically refers to the employee's opportunity to make changes. And so I kind of use them interchangeably, but just want you to know what each of those terms mean as we talk about the first question here, which is why do we have the renewal or re-enrollment season every year? Well, first off, from an employer perspective, it is an opportunity for you as an administrator or group plans member to evaluate what you offer. And so to evaluate your plans and your benefits for your staff and what you offer. So you can do this every season during this time. But also, it's a opportunity to be reminded of your plan benefits and any plan changes for this year, and to educate your employees on those. And then lastly, probably most important and the primary opportunity during this season is to allow employees to make changes to their plans, whether they're enrolling for the first time or re-enrolling. All right, and Cade, do you want to talk to us a little bit about some top renewal questions to ask during the season?
Yeah, most definitely. So I'll just kind of talk through some of the top renewal questions to ask. And this is not just for those ministry partners that might be on a Guidestone health plan right now. These are just great questions to ask as you're evaluating or going through this renewal period, whether it's through another carrier or also, maybe through a local broker, those type of things. These are just great questions to ask. Number one being, do my benefits still align with the culture of my ministry staff? So this is really, as Jacob and I and everyone here at Guidestone like to say, is the internal audit portion. You kind of see and take a pulse of the staff. Hey, are these benefits working for the staff? Do they like the benefits, or the plans aligned well for the needs that they might have? You want to make sure that you are, filling in the gaps and covering those things that they do need. A lot of the ways that we do that, whether it be changing plans around, moving from maybe a higher deductible plan to a lower deductible plan, or vice versa, those different things. And you'll hear us talk more about that as we move through here. Number two is, am I benefiting from a risk rated solution, or am I currently community rated? So for a lot of our ministry partners or just ministry partners in general that are less than 50 employees, and you're with one of the major BUCA carriers, you're most likely community rated. And what that means is that they're just taking your average age, the genders, and the geographical location, and giving you a rate based on what that area looks like. The great thing at Guidestone is for all groups as low as 2 employees, we will risk rate you. So what that means is we take all of that information that is gathered through community rated, and we also evaluate the health of each individual as well. So for those groups of 2 or smaller groups, or even our larger groups, when we're looking at claims data or with our artificial intelligence tool, those type of things, we're really putting or allowing your group to be in the place that we feel is the best fit long term. So we're creating that consistency and longevity, being a part of a Guidestone solution. So just kind of some things to consider. Maybe you are a smaller group and could benefit from a risk-rated solution, or even a larger group that could as well. We'd love to talk through that with you, as you'll see a little bit later on. The third question is, what do my current claims look like? So for some of our larger ministry partners, you will get some access to your claims data, whether that's through us internally here at Guidestone, or also if you're with another carrier, you're probably getting some sort of information about that, to kind of see how the group as itself is running. And if you don't get access to claims data, you can still kind of know how, your ministry or church will be running based on what your renewal looks like. So if it's a, high renewal, low renewal, you can kind of get a feel of those type of things. And it's also a great time when you're evaluating that information and the high level overview to kind of utilize the wellness tools and programs, talk to staff about that, which really leads into my next point here on the question number 4 is, do my employees understand the benefits of my plan? Jacob mentioned a minute ago about education. This is a great time to educate your staff on whether it's a new plan that's being provided, going over some of the plans that you've had for many years. Just a great way for them to understand, this is what I have access to,
Yeah.
not just the co-pays or the co-insurance, whether
Mhm.
that's, a smart shopper benefit where they can get cash back, or utilizing quantum health, which I know we'll talk a little bit more about as well. And then lastly, do my plans have value-added programs to serve my ministry well? So along those lines of the value-added benefits on question 4, Quantum Health, the one-stop shop concierge service that we have here at Guidestone that a lot of our ministry partners take advantage of, kind of knowing where to go for care, as well as Smart Shopper, as I mentioned, the ways that staff can get cash back by simply just using the plan. Great resource, as well as Sword Health, Twin Health, some other things. And we'll really talk about some of the new value adds that are coming in 2024 here in a few minutes. So I'm going to toss it back over to Jacob. He'll kind of talk about the re-enrollment process.
Yeah, thank you, Cade, for walking us through that. Let's talk about now how we can make re-enrollment easier for you and your staff. So number one, you want to utilize your broker or account or relationship manager. That way you can ensure by having that conversation with your relationship manager that you're offering the right benefits, or I would say the best benefits that are suited to your staff. And you'll see each of these points really are about the fit when it comes to your benefits package and your staff. How well does it fit and suit your staff? So one thing you can do is you can engage them through a survey. You can just check in with them during the season and make sure that they're satisfied with the current benefits and that they're aware and educated on the benefits themselves as well. You can, of course, evaluate your costs and your claim spending, as Cade referred to. This may lead to some changes. This may lead to a lower deductible or maybe a higher deductible health plan. And then you want to evaluate your current offerings once you have that information, once you have that data, and see, hey, do we need to make some changes here? And again, it's about the fit. Does your deductible, copay, and plan structure fit your staff's needs? And then also, outside of medical, this can also refer to your ancillary benefits and your total insurance package, because it does go beyond just medical coverage. In terms of ancillary coverage, there's of course dental, and then disability and life insurance. Am I protecting my staff as a whole? And so you want to evaluate the ancillary side of things during this process as well. The renewal season is a great time to look at maybe adding ancillary coverage that may have been overlooked previously or may not have been added yet.
Mm-hmm.
Secondly, you want to adhere to the timelines and to your deadlines so that you stay on target. This ensures that all of your employees are enrolled or re-enrolled by January 1st and that their ID cards arrive on time. This ensures that your billing looks correct. And Kate is actually going to walk us through these deadlines later on, and this timeline specific to Guidestone groups and what that looks like. But we want to make sure we're sticking to these timelines so that we stay on target, so that we accomplish our goals during the season by January 1st, and your staff is equipped with what they need by January 1st. So you really want to stick to that employer and employee timeline so you stay on target as much as possible. You don't want to be kind of that group that reaches out to your relationship manager in December and tries to accomplish all of this in 1 week. It's just not going to be the best idea for you personally, but also for your staff. So just want to start by checking in October. And again, we'll go through this timeline here in a bit, but just want to stick to these timelines and stay on target as best we can. All right, next, we want to utilize the tools for re-enrollment that are available to us. So specifically for Guidestone, if you need to make changes, you can actually do that through your relationship manager. Through that conversation, we can get you an annual election form, which is kind of an abbreviated contract that we use during the renewal season, so that we can make these changes quickly and efficiently for you. And then from there, you want to hop on to the re-enrollment tool in EAP, our employer access program, so that you're actually confirming your plans and confirming your renewal for next year. And then lastly, the final part of the tool that's available to you is re-enrollment for your staff. So you've renewed as a group at this point, you've gone online to do that part, you've confirmed your plans and renewal for next year, but how do I re-enroll the rest of my staff? Well, if you're with Guidestone, you actually have 3 options. You can do it through that re-enrollment tool in EAP by choosing the administrator online option. You can release it to My Guidestone, your employees' My Guidestone accounts, so that they can re-enroll online, or you can use paper re-enrollment forms. So as you can see here, we're giving you options to be able to conduct re-enrollment for your employees and to renew as a group. We just want you to take advantage of them and choose the option that best suits you and your staff. All right, fourth, you want to discuss your utilization and understand the current trend. So this to me is all about setting expectations for next year. You want to reflect on this past year, as Cade mentioned, your claims over this last year, and take a look at how you're running as a group. How are we running, so that we can plan ahead for next year? So you're setting expectations along with the medical trend figure. This is released every year. This can give you a good idea of medical inflation for next year. This figure is something that can help you also plan for next year, along with your unique claims experience, so that you're setting expectations for next year. This is something that my actuarial team is doing when they re-rate you as a group. We're looking back at your claims in the past and then planning for the future to anticipate future claims. So we want you to be able to do the same thing with the benefits that you're choosing to offer, because this may mean, depending on the expectations for next year, you may need to make a change in medical plan offerings and what you're offering to your staff. So just something to think about and to understand. All right, and lastly here, you want to educate your staff on changes. So this is a big passion of mine, is educating you and your staff on what is available to you, not only on the plan and how it works, but the wellness tools. You know, we've touched on these briefly already, but there's Sword and Twin Health were added this past year. And for those members that know about this and have used it, we've gotten some great feedback on these tools and how they've actually reduced claims costs because of the benefits that they provide. These are free services and free tools for you and your staff to use. Quantum is one you may have heard of. We added January 1 of 2022, your one-stop concierge service for you to be able to talk to them and have care navigators advocating you and holding your hand through that process. So again, another free service for you to use. But my passion and my hope is that you would be aware of them. So this is something that your relationship manager is going to communicate to you and let you know of and remind you of, but you want to be communicating that to your staff as well. There's an opportunity here for your relationship manager to do an enrollment meeting for your staff. And so that way they're not just talking to you, but they're talking to your staff about these tools and about how the plan works and any new products and services. This is something that your RM will communicate to you. And so you want to be aware of these things. Again, this is the purpose of the renewal season. This is the purpose for why you want to educate your employees every year, so that they're taking advantage of this and they're well educated so that they can use it well. So I think it all comes down to reading your emails. So if you will just do that, I think you will be just fine. So how can we control costs during this time? During the renewal season, I would say it is of utmost importance that you're speaking to your relationship manager, or outside of Guidestone, your broker or your account manager, so that you're having that dialogue with them and bringing them in on this conversation. I'll give you an example of that here in a second, but you know, while you're reviewing your budget and again, setting expectations for next year and looking at plan options, maybe even tweaking some things, that is a conversation you want to have with your relationship manager. They need to be in on that so they can help guide you through that. So they can walk you through the details of it, but also talk you through the implications of it as well. That leads to an intentional health plan strategy. Now, what do I mean by health plan strategy? You reflect on the past couple of years and your claims experience and how you're running medical trend for next year, and you reflect on how these benefits are working for you and your staff. You again start to budget, but then you also start to make changes as necessary to adapt. But then you educate, and then of course you re-enroll your staff, right? So that to me is a strategy, and that's what it looks like to me. Now, on that note, just an example, you can explore HSAs or HRAs and other premium saving strategies. This is one of many strategies. And a real life example is last year, I did have a group come to me and say, hey, we're looking at maybe trying to shift our staff over to a qualified high deductible health plan as much as possible, right? And we want to start contributing to HSAs, since they are qualified to be paired with HSAs. And so I said, okay, let's look at maybe some models of what this would do and how it would impact your budget. And so I took them through that and walked them through the different qualified high deductible plans that we offered. And okay, if you contribute this much to your HSA, how does that impact your bottom line in your budget? And so walked them through that until we could find the best strategy going forward, the best plan options for their staff going forward. Then I conducted a re-enrollment meeting for their staff and educated them on not just how the plan works and how a qualified high deductible plan works, but the benefits of an HSA. And so and why they should maybe think about the HSA if a church is putting money into that for you. What are the tax benefits of it? And then we of course told them how to go through re-enrollment. We actually, in that circumstance, released it to their My Guidestone account so they could re-enroll online and choose between maybe going over to the qualified high deductible plan or sticking on the other plan. Now, we actually saw a lot of employees shift over to the qualified high deductible plan and actually take that option. So to me, when I look back, I see that their strategy worked because they were intentional with reaching out to me and having those conversations with me and involving me, but also they were intentional with their staff. They cared for their staff really well in that with that change. And so that was a really good example of controlling costs by seeking out maybe another premium saving strategy that they hadn't tapped into before. That is exactly what this season is for. You want them to be educated on the tools and the resources and how the plan works and how to re-enroll. And so you can do that best by talking to your relationship manager or your account manager about, hey, how can we control costs? What should our strategy be? This is kind of what we were thinking, and where do we go from here? So it's all about having that dialogue with your relationship manager to start with. All right, Cade, I'm going to toss it back over to you now to
Yeah.
take us through some general renewal tips for this season.
Yeah, definitely. This is such a great slide, and Jacob went over such great information for those that are on a Guidestone plan and those that might be looking to be on one in the future. This slide right here is really the heart of what we do. You can see with the integrity of our hearts and the skillfulness of our hands, we serve those who serve the Lord. You can see right there reflected back in Scripture in Psalm 78. And as Jacob was mentioning, a lot of intentionality with conversations that we have during this time period with you, whether that's when you're going through that renewal with us specifically, or also talking to a member of our new business team, whether it be myself or anyone else on that team. We really try to take that mindset of helping you bridge the gap. And what I mean by that is, one, we want to help guide you through this process. We want to help educate you, see what your different options are. We also want to advocate for you. We want to advocate for what the ministry needs might be. We want to try to come up with solutions that can help bridge those gaps. And then lastly, we want to provide that resource for you, whether that's the actual health plan or just the education piece or anything that we can do on our end to be that for you. And I always say that just with the fact that we have a different type of skin in this game, whether we or just having a conversation about adding an employee, or whether it's talking about implementing a new health plan. If we don't do our job well, that can impact your ministry, that whether it's there at the church or at the ministry. So we truly want to serve you. If we're doing so already, thank you. If we are not, we would love to have a conversation with you and see if we can do that moving forward. Some things that separate Guidestone, number one being our aligned Christian values. So along with our health plans, there are going to be some exclusions. Really, a couple are: we do not cover abortions or abortive services. Second one being we do not cover gender reassignment surgery. And then lastly, we do not cover same-sex marriage coverage. So these are just ways that that if you're contributing or just being a part of a Guidestone health plan, you know that your dollars are going towards something that's biblically aligned, which is huge for us. We
Yeah.
realize that your staff or yourself would never do anything like that, but just to know as a whole, the body of believers here at Guidestone that are enrolled into our health plans and any of our other insurance products are biblically aligned, and all the products that we offer are biblically aligned, which is huge for us, and I know it is for you as well. Secondly is just smart stewardship. So getting to choose from a variety of plans or unique options that we have here at Guidestone. We don't want to just offer one plan to you and say, hey, here's the health plan that you get when you come to Guidestone. We want to come with options. So whether it's matching your current plan benefits or if it's this is completely new to you and looking at all of the health plan options we have. I know Jacob was mentioning our high deductible health plans. We also have our comprehensive plans, which are lower deductible health plans. Whatever the needs are for the staff, we want to have a product that can fit those needs and be the best solution. That way we are creating that intentional health plan strategy and not just giving you one of our health plans and thanking you and then taking hands off. We want to really be there and help as well with budget needs when there are things that come up year to year. And I know Jacob's team does a great job of that from planning, not just for next year, but 5 and 10 and 15 years from now, because we want to be a ministry partner with you for the life of your ministry. So,
Yeah.
and lastly is just the quality of coverage. So you'll have access to nationwide networks and built-in health and wellness benefits. What that means is on our health plan specifically, we take advantage of the Highmark Blue Cross Blue Shield network. So it's the nationwide Blue Cross network where over 90% of all doctors, hospitals, and medical facilities are in network. And it's not just in the state that you're in, but it also travels with you. So, we've specifically tailored, I think it's over 20 different plans that you have the option with through Highmark, and we've have those exclusions carved out through them to be a biblically aligned plan. And also the wellness benefits and some of the tools that we have created or provided to our ministry partners. Jacob's already mentioned Quantum Health, really a great care coordinator, just a one-stop shop that really is a benefit that unless you had really over 1,000 employees or so, you would get to take advantage of, but
Yeah.
we're able to offer that to as low as a group of 2. So it's super awesome. We're able to do that, as well as, Sword Health, virtual physical therapy. I know we've had a lot of traction with that and really helped a lot of people with that, as well as Twin Health and Smart Shopper, which is my personal favorite, just a way that you can get cash back by simply going to get that MRI or just utilizing the plan. Those type of things. And, at Guidestone, we are a nonprofit ministry, and I always like to say we're a for growth ministry because we're trying to pour any dollars that we get back into the plans to help serve you the best that we can and really help bridge that gap and guide, advocate, and provide. So kind of moving on here, kind of talking about what is new to Guidestone. So just as I was mentioning, we pour those dollars back in and try to create new things or fit needs that we are hearing in conversations that we're having with ministry partners or prospects, anything like that. We want to enhance the products that we already have. So first being enhanced teledoc services. So you'll see there's going to be some ads there with the teledoc services, and all of this will be super high level info here that I share with you, just because a lot of the details are still being ironed out for January of 2024 when this starts. But so enhanced teledoc services being the first one. You'll also see the in-house vision product. So if you do take advantage of our VSP vision product, you'll know that that is not an in-house product and on your Guidestone bill, but coming January, that will be. I know Jacob's team is super excited about that.
Definitely.
Just in those conversations. So we're super excited about that, as well as new retiree coverage products. More to come. Please check your email and things like that, as Jacob has already mentioned to you. And then new medical plan designs, as we were mentioning, whether it be additional high deductible health plans, additional comprehensive low deductible plans. We're trying to fit those gaps or fill those gaps to provide every solution that we can that our ministries and churches need. And then lastly is going to be our new life insurance products. So more to come, definitely there. Don't want to get into too much of the weeds on that, but just please be in the loop. Check your email for the marketing campaigns and seeing some of the new products that we have coming for January of 24.
Great. Yeah, so just some key dates to keep in mind here. I mentioned these earlier by sticking to the timeline as best as you can. The way you can do that is have these dates on your calendar, have these dates before you. Now, your relationship manager, if you're with Guidestone, will be reaching out to you in September to start communicating this renewal information to you and just kind of give you a heads up on a few things, especially those plan changes, new products, rate information. But on October 3rd, all of your rates and your rate booklet, all of your renewal documents will become available in EAP, as well as the re-enrollment tool goes live on the same day. So October 3rd, that's a date to circle. All rate, renewal information, and documents, as well as the tool going live in EAP on October 3rd. Now, by the 26th of October, you want to have any plan changes submitted through your relationship manager, or you can go in and confirm your plan selections by this date. But you want to do that by the 26th. So you want to confirm your renewal and any plan selections by the 26th. Again, you can do that through EAP in the tool. And then November 9th, that's the employee election date deadline for employees to get their changes submitted. So those are the dates just kind of want to put before you. October 3rd, kind of kicking things off, and then employer deadline on the 26th, employee deadline on November the 9th. All right, now we want to start opening it up for questions and see what questions have been submitted so far and what questions we can answer here in the feed.
Yeah. Thank you, Jacob. And we're going to open it up now. So if you do have any questions, please feel free to type those in the chat and we will get to those as soon as we can. We have a couple here. First one
Great.
being, should I shop for my benefits every year? It's a great question, Jacob. You think you got that one?
I think I can help a little bit. I can advise. I would say, this is going to be a little bit subjective, but I do believe, because there are going to be some groups that do shop every year. There are going to be some groups that shop every 5 years, every 10 years, maybe. So there's a big scale there. But I would say my recommendation would be every few years. I do believe it is good to shop. Make sure you're being a good steward of your, the budget that you've been given for your organization. We want to be good stewards of it. So I do think shopping around and just looking and seeing what else is out there, evaluating those options every few years, I would say on average every 3 years would be good. That is what Guidestone does with our vendors. So we've mentioned some of them today: Highmark, Blue Cross, Blue Shield, Express Scripts, Cigna, Unum. So the vendors we use for our products and services, we actually do shop those every few years just to make sure that we're providing the best for our members. So I kind of use that as a good guideline. So I think every few years is good to think about and consider and just see what else is out there. And you may find something, you may not find anything, but you know that you're stewarding your dollars well by doing that.
Yeah,
So
I love that. I love that. That was a great question. Let's move on to another one here. Is what non-medical insurance products should I look at during re-enrollment?
Yeah, I would say, so this is where we refer to as ancillary coverage. So ancillary being disability, of course, dental, we think about that when we think about medical, we think about dental. So dental, of course, disability, but both short and long-term disability, and then life coverage. I would say a lot of groups that I work with may have one or the other when it comes to long or short-term disability. But I would say maybe consider both. Even if one of them is optional for your employees, I think you would have a lot that might be interested in that, because a lot of times long and short-term disability work together. So it's good to have them paired together as an offering for your staff. So that may be a gap in your ancillary coverage that you might want to look at adding. Also life coverage, I would say it's very important for you to offer at least some kind of base amount of life insurance to your staff, because what we're talking about here is protection in all forms of insurance coverage. And so it's not just the medical plan, right? You want to protect them on all sides. And so that means disability, that means dental, that means life coverage. And so providing a base amount of life coverage, but also maybe the option to add more. And that could be for their dependents as well. So that's something to think about. That is for sure a conversation you want to have with your relationship manager of, hey, are there any gaps that you see here? Or, hey, I was thinking maybe we go ahead with life insurance. We haven't done that before, or we go ahead and add short-term disability because we haven't offered that before. That's a conversation you want to have with your relationship manager. And on the first question too, on shopping, that's a conversation you want to have with your relationship manager too. Bring them in on that. It's all about, we had that one slide about your dedicated relationship manager and cutting costs. It's all about opening the dialogue during the season. That's
Mm-hmm.
what this season is for. That's where you're going to talk to me the most, or your relationship manager the most. And you might get tired of me and all my emails that I want you to read, but it's really important to open that dialogue and involve your relationship manager, whether you're looking to add coverage on the ancillary side and protect your staff better, or maybe you're looking at shopping this year. Maybe it's this year, but that's a conversation your relationship manager can help you with. And it's because I see it more as a collaboration, right? It's
Mm-hmm.
not a competition. It's not a, hey, let me get this done and move on to the next group. It's a collaboration. I'm collaborating with all my groups very intentionally during this season. So I want to
Yeah.
collaborate with you, whether you're shopping or looking to change something or create a strategy. And so that's why this season is so important.
Yeah, definitely. And I'll just add just a little bit to that, Jacob talking specifically about the life insurance product and everything. The big piece that I see a lot when talking to, on the new business team, talking with potential ministry partners and when asking about life insurance or disability is if something were to happen to a staff member, would the church feel obligated to help and contribute a certain amount of money or those type of things to
Mm-hmm.
that staff member? And if the answer is yes, which I find it is most often,
Yeah.
well, then let's talk through what product can we provide to fill those gaps. The great thing with the life insurance product too is, as Jacob already mentioned, the optional life insurance that kind of puts some skin in the game for the staff member if they did want additional life insurance to help, they can contribute themselves towards that amount. But I would say definitely if you aren't offering some sort of life insurance benefit, at least some base amount, $10,000, something like that to help cover a funeral cost at least. So that was a great question. Thank you for that.
And that's cheaper too.
Yeah.
That way is cheaper than
Mm-hmm.
hey, let's get some money and funds together
Yep.
to cover this on the backside. If you're funding it on the front with premiums,
Mm-hmm.
that's going to be cheaper.
Yeah, most definitely. That's a great question, and we appreciate that. Kind of moving on here to another one is, how do I figure out who to talk to during renewal if I need to make a change?
Well, that would be me. So, but not for every group. So,
No, everyone go to Jacob.
yeah. So you have, if you're with a Guidestone on a Guidestone group plan, and with us, you would have a dedicated relationship manager that you can speak to. So hopefully, if you're like, for instance, one of my groups, you got an email from me a couple weeks ago, just
Mm-hmm.
checking in, sending you a nice little video I made. So you would have my information there. But also, like I mentioned, we're going to be reaching out in September, both me and my marketing team, with my contact information included. So at the bottom of that email will be a signature with all of my contact information. And the same for you if you have a different relationship manager. I work with a wonderful team, and so they're doing the same thing. They're checking in with their groups. They're emailing you, and we'll be in touch in September with your renewal information. And so that's the first stop shop. Check your emails. If I don't know if I've mentioned that yet, Gabe, but check your emails and look for that contact information from either myself, your relationship manager, or from my marketing team. But on top of that, if you were to call your group plan support team, who does a lot of our billing and employee transactions for us and takes care of that, processing that for us, if you were to call them, they can definitely immediately connect you with your relationship manager. They
Mm-hmm.
know who we are and which accounts are ours. But even if you just called our general customer solutions number, if you just
Mm-hmm.
dial that, they can also see who the relationship manager on the account is and connect you with myself or whoever your RM may be. So that's what I would say. Those would be your options to connect with the right person. But it would definitely be during this renewal season, your relationship manager.
Yeah, most definitely. And I think that Jacob and his team do a great job too of just general questions or thinking about making changes. That's where I know they would ask to please reach out to them as you are even thinking about those things, because
Yeah.
they can provide information that you might not have access to or things like that, just to help you through that. So another great question. And then the last one here we have is, what should my first step be during renewal?
First step during renewal would be
Email Jacob.
yeah, yeah. Well, look for Jacob's email, I guess would be a better example. But I mean, there is the preliminary step to reading that email in detail from your relationship manager. And I know I've harped on that a lot, so I won't belabor the point. But I mean, that would be the first step. Your relationship manager is going to reach out in September, but that's kind of like the preliminary step. So I would say that is extremely important. But I think if you want to make sure you log in on October 3rd, log into
Hmm.
EAP, pull your renewal plan documents, pull your rate booklet, start looking at the tool. If you're ready, if you already know, maybe you're not even making changes next year, go ahead and go through the tool.
Hmm.
Technically, I would say, by the book, that the tool is your first step. Go through the tool and complete the steps of the tool so you can renew as an employer and then conduct re-enrollment, and go from there for your employees. But one that's kind of 1B. 1A is look out for that email from your relationship manager, because again, that's us reaching out to you to intentionally start planning with you and give you a heads up on renewal information, but then start collaborating with you to
Hmm.
start opening up that dialogue with you. So look out for that, and then October 3rd is kind of
Yeah.
the next step.
Yeah, and I would say for those that are not a current ministry partner with us, and thinking through maybe your renewal is approaching,
Yeah.
just kind of thinking through, hey, is the benefit that I'm offering right now working for the staff? Kind of like we talked about earlier about that internal audit. It's a great time to do that. Kind of, maybe take a pulse of the staff to see, hey, what would they like to have in their health plan, or what could we maybe offer to help them and drive some of those claims down and different things. But that's where, our team, whether it's the new business team or the relationship management team, we're here to serve you, whether you're a Guidestone ministry partner or not. Like I mentioned earlier, with a different type of skin in the game, it truly is, our heart is to serve, whether that is with Guidestone specifically, or it's through a other carrier, or a local broker, different things. As you can see here, the Let's Talk slide here, just kind of talking through, if you are a Guidestone ministry partner, please feel free to scan the QR code and schedule a meeting with our team. We can definitely get you in touch with whether it's your relationship manager, or if you're looking to offer maybe a new product, someone on our new business team.
Mhm.
I urge you, if you are someone who is not a Guidestone ministry partner, please, please, please just scan the QR code and set a meeting with whether it's myself or someone on our new business team,
Yeah.
just because we'd love to get to know you more, get to know your church or ministry more, and see what we might be able to do to assist you and serve you, whether that's coming to Guidestone or evaluating your renewal with another carrier. As I mentioned, we're here to serve you, and any way that we can do that is what we're about. So, and that was really all that we had today. We appreciate everyone that joined us. Those that are going to listen on the recording, we appreciate you as well. And if you do have any other questions that maybe weren't answered or didn't put in the chat, please, please, please contact us. We'd love to serve any way that we can.